Hello, I'm Aggi Kozlowska, and today I would like to talk about how to do a proper pelvic tilt. Pelvic tilt, to me, it's a foundation exercise to start rehabbing your low back or any injuries that happen right around low back. Essentially, what happens whenever we injure ourselves, that section or region or part of our body does not work properly. Muscles do not fire properly. Therefore, the mechanics of our body is affected or are affected, and we don't move properly. We do not move efficiently. We need to reboot. We need to tell our body we want to restart everything again and build that pathway again. Pelvic tilt is a foundation exercise. To me, we have to get it right before we can move on to any other core exercise or any other low back exercise. And that should be basically like a bread and butter of our low back or core training. So let's lay down on our backs. So here we go. And I have no shirt purposely to be able to present and show what are we looking for. So we're laying down. And first of all, about a setup, we want our knees bent, our hips on the floor. We would like to lay in a straight line and our shoulders away from our ears. We are also going to pay attention to our ribs. I do have pretty wide rib cage, so it's very easy for me to pop my rib cage out so it really sticks up. Let's not do that. So right away, we want to start engaging the core from the top and bring those ribs a little bit lower. So our setup in a perfect world should be so we have very little slight space between our low back and the floor, and our ribs are just more in neutral. They're not pressing all the way down, but they certainly are not splaying out. Pelvic tilt essentially involves our pelvis moving down so that we engage our abdominal muscles, our low back, and we press our low back into the floor. So let's try that. First of all, I'm just gonna show what it looks like, and then I'm gonna go through the details. So I am going to inhale, and as I exhale, I slowly bring my low back down to the floor, and then as I inhale, I come back up, ideally to neutral. One more time. Inhale. As I exhale, down, and then come back up. Now let's go through a few details. First of all, our feet are on the floor and we're trying not to push off our legs. I'm pushing off, that's pretty big movement right now, but it's very easy when we're not having enough strength here to be pushing off of our legs as well. So I'm gonna show what it looks like. I just pushed. I pushed so hard that my pelvis almost popped up. I don't want that. This is an exercise that we want to engage only our core at this point and be able to actually isolate it. A lot of times what I do see in my clinic is that people are trying to do this exercise bypassing the use of their core, and that's a problem. That means, to me, this is not working and it's not supporting your spine. Hence, you are at higher risk of low back injury if you have not already have it. So first of all, let's disengage the legs. They're just there to support. From here, I'm gonna imagine I have little suspenders from my hips to my ribs. And as I bring my low back down, they get closer, they contract. So let's try. Inhale and watch my low back. It's gonna come down to the floor. And then slowly up again. And then again. And then slowly back up again. Now let's pay attention to the ribs. What I'm looking for here again is so they don't keep moving too much. They should be staying pretty neutrally. And again, inhale. As I exhale, I do engage my abdominal muscles so my ribs come down as well, and they decrease this distance between my ribs and my hips. One more time. Inhale. As I press my low back down, I decrease this distance. here, my abs contract, deep core muscles contract, and then I come back to neutral. When I come out of that pelvic tilt, I don't hyperextend. That's too high. That hurts. That is wrong. We don't want to go this high. Unless you are training for Cirque du Soleil, don't do it. We don't need that. All right? One more time. Neutral, ribs down, hips down. Let's also pay attention. Not too much is happening up here. I'm moving my arms, explaining, but really there's not a whole lot of strain happening in my upper body rather. So what happens to some people when there's no strength here, they try to tense up through the upper body to engage the lower body. That also is wrong. So we want to imagine this part up doesn't move. This part moves a lot. This one is only to support. So let's do 3 more times together and then we'll pause. So inhale. I'm now gonna show that low back clearly. And then I'm going to come to neutral, up, and again. And then one more time. I inhale as I come up, and then one last time. And pause again. Let me come up. And again, I'm Aggi Kozlowska. I want to help you feel better. Let me know if you have any questions or concerns. Leave a comment below and have a great day.